Good morning, Dr. McGett.
Hey, good morning, Ray.
Good morning to you, and congratulations. I'm just looking over Twitter a couple of minutes ago, and it looks like I've got a whole bunch of white coats standing in front of the emergency room waiting for the first patient to come in.
Well, I don't see a single white coat out there, but that's good news that there is some white coats around.
Now, the picture that I have has 3 white coats, and looks like 3 or 4 other folks from different parts of Guam Regional Medical City.
Right. No, we're ready. As you stated, 7 o'clock this morning we opened. And, I appreciate especially Frank's discussion. I mean, our motto here is where patients are partners, and Frank uses the term partners all the time. And he's a very important partner to us also here at the hospital. And so the negotiations continue with his insurance and with the rest. And in fact, we think, and Margaret has reassured us that it's gonna be completed today. And so we're looking forward to that.
That is the agreement between GRMC and SelectCare?
Yes, sir. Correct.
Okay, interesting. Now, and continuing negotiations with a number of other folks that we'd identified previously. What's the big hang-up between GRMC and Take Care? Are you guys even at the table?
No, we're not even at the table. Take Care basically states that until we become CMS or federally certified, that they're not even going to be in the same room as far as discussions. And so then obviously we're going for not only a CMS certification but Joint Commission certification. And so once we get that in place, then I guess we can sit at the table with them.
Okay, but and what's the time frame on that? Now, as I understand, as the doors have already been opened over at GRMC, as you begin to put together a portfolio of work, a body of work, you now have things for the Joint Commission to look at and the CMS folks to look at when they do come out.
Correct. We have actually already turned in our request for survey with the Joint Commission, and we're requesting for what is called a deemed status. And as you get the deemed status, then CMS then will allow us to have the certification with them once we get deemed status with Joint Commission.
Okay, and once that happens, then it's like it's just kind of understood until the actual certification comes in that you meet all of the goals and the requirements.
Correct.
Interesting. Now, and so Take Care won't talk to you unless you've got CMS. Now, there have been times in the past where the CMS standards might not have been upheld over at Guam Memorial Hospital. You recall there was a time, I don't know, in the last year or so where there was jeopardy. Would that have meant that the insurance companies, or that one in particular, would stop allowing their patients to go there?
No, on Guam, unfortunately, the GMH at that time was the only hospital. And so they would, so CMS would allow them to be seen, because where else are any patients going to be able to be seen?
Yeah.
If they are, Medicare or Medicaid or Medicaid insured. And so, but GMH never lost its CMS certification.
But had it, then it would have been just a question. It wouldn't have made that much difference because you still have to take people still have to go someplace to get seen.
I think so, but I don't know the specific details. Obviously, there's a large, big book at the Federal Register that probably explains that in detail, and I don't know that.
Yeah, it's very deep in all of the rulemaking and things that you've actually got to look up here. Let me ask you just real quick a question on the VA policies, because I know that the paperwork that I read says if you've got a referral and the authorization looks good, then you can be seen at the facility.
That is my understanding, correct.
Okay. Are you seeing a lot of vets at this time?
We have seen quite a few, actually, on an outpatient basis, and we have actually done a couple of surgical cases on vets. Okay. And so, yes, the answer is correct.
I know that there was a big get-together over at GRMC specifically targeting the veteran community.
Yes, and as an vet myself, there was an important part of the communities that we wanted to make sure were involved, and we wanted to be able to show them what we had to help them with their medical needs.
All right, gotcha. And as you say, the doors are open over at the emergency room. It's 7:55. As far as I know, you haven't seen the first patient yet, have you?
We've seen patients here, but not today for the official opening of the emergency room.
Okay. Well,
I think you probably scared them away.
I don't know. It wasn't me. I just answering the telephone. Lady had a question, but I'm glad to hear that regardless of what insurance company you've got, if you've got insurance, then go to and you get hurt and you need to see the doctor. The rule has always been go to the emergency room. Don't wait it out. Don't worry about what card you've got in your back pocket. Go and get some help before the situation gets more and more chronic. One last thing. thing before I let you run. Have we made any babies? Not made any babies. Delivered any babies?
Yeah, many babies being made. We have still yet to deliver one. But we are. As I stated before, Guam, makes a lot of babies, and so we'll be getting our fair share at some point.
All right. Well, maybe they can help out the cause with some more load shedding or something like that.
There it goes.
Doc, I'll talk to you pretty soon. Thanks for the call.
Okay. Thank you.